follicular movement of teeth is something that I noticed a good many years ago, and it's something that if you learn how to use it, you can guide and direct teeth, even though they're not in the mouth at the time, simply by taking the pressure off of one side. The tooth will push toward the other side simply because of a little follicle that is around the crown of the tooth. Actually, as a tooth forms, you'll have say a cuspid tooth forming in here, and it'll have a little follicle around that tooth. And if you press this tooth against another tooth in there, well, it'll flatten this follicle out on one side, and the other side will be pushing against another tooth over here. It'll just flatten out on two sides of the tooth, of the follicle. Now, if you eliminate the pressure on one side, just take it away, there's no pressure over here at all, then this follicle will round itself out. As it rounds itself out, it moves this tooth over in that direction. So you can actually guide the tooth around by how you put pressure on it. Now, bone structure doesn't affect this follicle. It'll just move through bone structure quite easily. It's a little more difficult in cortical than cancellous, but it'll still push cortical bone out of the way too. So watch this as it goes along. It's a pretty interesting thing to see. Here's a case that we could have done serial extraction, or we did in a sense do serial extraction on this case, where we just took some bicuspids out. And I'm going to run through the case right quick. This is crowded, but not too terribly crowded. It was pretty much class 1, and so we had planned to take some first bicuspids on this case. We're just going to kind of empty this whole area right in here and let these teeth back up into this space and line themselves up, and this could come in and fill in the rest of the space, and you just have the second deciduous molar to deal with right there. Alright, on the other side is the same situation. Now up above, you look at the arch form. You'd really like to widen it out some, but you don't widen it in serial extraction because you just eliminate the teeth, and then the tongue pressure tends to push out on the teeth, and it tends to move out on them to maintain that if the patient is functioning normally. The bottom is crowded, but not terribly crowded. So here's what actually happened here. We took the baby teeth out, and then we came in and took the permanent teeth after they erupted a little bit further into the mouth. We removed the permanent teeth also. And if you just follow the case through, the case got better all the time. Excuse me. It wasn't perfect by any means, but if it had no other orthodontics, it would have looked pretty decent, much better than it would have if you left the crowded situation there. So the teeth come in, the cuspids, the laterals and everything are coming in. The cuspids kind of drop back into this space, and it continues to develop. The cuspids finally get in, and they've lost the deciduous second molar over here, which you're going to let this tooth, this will kind of move back in here, and then this will go, and this will move back on this side also. And the teeth in the back will drift forward in a forward direction, so they'll close in some of the space too. And it'll amaze you, you can do pretty good on a case that's functioning properly if they, go along with you and go ahead and remove it. Now that girl has a little too flat a face, for me nowadays, and she probably doesn't think anything about it, but I would rather have a little more fullness of the face as the child grows up. Now, I was straightening her father's teeth at the same time, and her teeth looked pretty decent at this point. Not ideal by any means, but a lot of people go through life with a lot worse situations than this. And this will smooth out to some extent if you got the person really functioning right, and they'll keep their wisdom teeth usually on a situation like this. And the spaces will close up. Now the arch form isn't quite as good as I'd like. I would rather have the tongue press it out further, but she didn't apparently push the tongue in there real hard. Now this is several years later, see, we've taken up some time doing this serial extraction procedure, and we kind of use this follicular movement in the serial extraction. You won't see that till we come to the x-rays on this case. Now that's looking fairly decent to just have extracted teeth, and I put no appliances in there at all. So looks like this film has got some mess on it here, but anyway, you can see what we're talking about, and it looks pretty darn good. But we decided to go in, since her was treating her dad, and he wanted them to look better than that, so we went in and put her in braces and finished it up a little better. Now here she is later in life, and we came back and bracketed the teeth and lined things up much better. This was 1978. See, we've been tinkering with this young lady's teeth now since I think something around 72, so you spend a lot of time on these cases, or you see them over a long period of time. You don't spend much time with them, but you'll have a case in there that you may work on for 6 or 7 years, and maybe even longer than that, just kind of watching the case and going along. Okay, so we go ahead and line it up a little better and finish it. We give it a fairly rounded out arch form, and the bottom is not finished by a long means. Of course, we just got a little wildcat wire in there right now. We are not near through with the case. Now here we go to a rectangular wire, and we'll have it lined up a little better, and you can kind of look at it and see the bicuspids are gone, and the 6-year molars, the second molars, have moved forward a good bit, and the front teeth went back like that, and we've got a pretty good arch form on there now. Okay, we took her out of that and put her in retainer, and that's 1979. And a fairly decent case, and most likely her wisdom teeth will come in. Now I want to go in and show you what actually happened inside on the bone structure. That's where the case, you really learn some stuff when you look at this. Now this is 4 of 1972 when we started this young lady, and so we had decided to extract these teeth. We had one, a pretty good problem here with the cuspids coming into the lateral roots, both upper and lower. The lower in worse shape than the upper. This lower cuspid right here, the lower right cuspid it looks like it's eating away the root of that deciduous lateral right. Well, that's not a deciduous lateral, that's a permanent lateral, and it looks like it's really resorbing this root a little bit. I don't think it actually is. If you take a PA picture, it'll show the root kind of superimposed over this. But anyway, you got a crowded situation, and bringing this tooth up in here can be a real problem, and you'll have to do a whale of a lot of expansion on this arch to get it in there. So let's go on to the next slide here, where we're going to come in and take the baby teeth out. So we remove the baby teeth over the first bicuspids, and now we've got the angle. This tooth is erupting in and here, and you see the follicle around this tooth where it's kind of flattened out. It's flattened over here, and it's flattened over this side too, you see. Similar thing here, there's a follicular pressure, but it tends to flatten out a lot in the tooth. And then over here it looks very normal, and we'll go ahead and bring it up there. Now let's look at this case. That's 5 of 73 after we took those baby teeth out. Now we're coming in here, and I think it's 7 of 73. We took these teeth out on 5 of 73. We removed this, 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 and on 5 of 73. Now look what happened during that time. The follicles, we'll have to go back and look at the follicle. It's flattened out all the way around. It's pushed up against the tooth like that. Now look at the position of that tooth. It's right covered this tooth. The cuspid's kind of over the lateral root there. Now we're going to look at it very closely. All of the follicles have rounded out, and the teeth have moved away from the tooth structure that the follicle doesn't have resorptive pressure, doesn't resorb this permanent tooth there at all. And it will be rounded out over here. There's no resistance, so the tooth moves back in this direction. And all this, it's gotten better just in 2 months' time. Now let's go to, say, to 1 of 70, January of 74, from 7 of 73, which you've got 8, 9, 10, and 11, and 12, and now we'll go to January of 74, so 6 or 7 months time, and look at the angle of this tooth now. See, and the angle of this one, and the size of the follicle around here. These teeth have just literally moved back away from the permanent teeth. You have to appreciate, you gotta really look at that. They were all virtually touching those teeth, and then now they're back away from them. So we've moved the teeth out of a crowded situation simply by making some space on the other side of the tooth, and the follicle rounded itself out, and when it did, it moved the tooth in that direction. And you will be able to use this a lot of times. Use it all the time. This tooth that was headed in like this, now it's headed out like that. Over here it's headed in, it was over here. You have to go get back and get my x-rays of those other teeth. Alright, that's January of 74. Alright, by February of 75, so we're just waiting some time in here. These teeth have backed away and now they've erupted into the mouth. The anterior teeth are lined up pretty darn good. This will continue to move forward. The wisdom teeth have formed in here, and we can see the closed bite situation in here, and the losing the deciduous teeth. I remember when I was in dental school, I had this person had a deciduous tooth root in there, and so they old surgeon department, oh well, we got to get this root out, so I had to dig that root out, and look at that root. It just literally goes away here. See, here's the next view, and that root is gone. It just resorbed away from the cells, I guess, that were still in there. And the whole inside of the crown's eaten away, but when the rupting tooth comes to the enamel structure, it can't resorb the enamel. Now, if you had a root out here, it's holding it on, you got to keep an eye on that, because that could stop this tooth from erupting. So when you have a situation like that, you just eliminate the tooth, or maybe the cells will go out of the way to eat it away. And anyway, you've got to lose that tooth to let the other teeth come on in a normal manner. Okay, here it is, 7 of 77. Now this is 5 years. See, we started in 72, and this is 77. And we've done nothing except extract teeth and allocate some space, and this was a class 1 case to start with. And it's, if they didn't have any other orthodontics, it wouldn't be a bad case. The wisdom teeth now have much more room, and they will nearly always come in like that. But we came back and put braces on it and finished her out real good. This is 2 of 95. Okay. So I'm going to end that case there right now.